Hello, everyone, and welcome to the 10th annual PFCC conference. We are so excited and honored that you've taken some time out of your day, and we know that everybody's working so hard in this environment. But to take some time, it really just, it inspires me, the fact that we have 455 people, healthcare providers, clinicians, researchers, patient and family partners, all making time for this conference. Why is that? Because a person-centered health system is more important now than ever as we engage with all of the challenges we have in front of us. I think it's I really want to acknowledge the fact that everyone is grappling personally and professionally with COVID and with social injustice. And so really thinking about how do we come together as a community, create connections, create fellowship in this alternate world where we can't be together in the same room, and think together about how we can approach these challenges in front of us and co-design solutions together that work for every stakeholder in the healthcare system. I think it's really important to think about what the virtual skills exchange, I'm sorry, I'm so excited, I'm nervous, I just want to reach out to all of you. I think it's important to think about what a virtual skills exchange, what does that mean? What do we mean by that? A virtual skills exchange is a chance for us to come together and really share ideas. Yes, we have some phenomenal presentations over the next 2 days from really experienced faculty members, but we also have all of you, that 455 people in this community that have solutions, that have critical information and experiences to bring together and again, build a sense of community around. We bring those ideas in and then we share them broadly. No competition in this area. No competition on a person-centered health system. We are in this together to create together, each in our own unique space with our own unique contributions. And then we spread. So we come together, we build a body of knowledge, and then we spread those practices in our own local communities, whether your community is a small rural health system, a national research team, national policymakers, wherever you are, wherever that sphere of influence is for you, we're going to give you all of these pieces back to have those in your back pocket, in your toolbox to help create the system of a person and family-centered health system. And what I mean by that is I invite every single one of you that have joined us today to contribute your ideas through the chat box, or share your challenges, ask questions, share your reflections, spark thinking, spark innovation. We're going to collect all of that, my awesome team over here. We're going to collect all of that information and we're going to put that back out for you, for each of you to carry forward in your work. So there will be a question at the end of every session that we really want you to think about and respond to through the chat box. We've had a lot of conversations over the last few months and we've really had to adapt so quickly, whether you're grappling with a family presence and how that looks and how we do that in a human and person-centered way, or whether you're moving your entire ambulatory network onto a telehealth platform and having to do that overnight almost. Now is so important for us to partner together with people with lived experiences in our health system so that together we can evaluate what that looks like, continue to improve so that everybody gets what they need out of this health system. So I know a lot of you have had to be very brave over the last 6 months. I think really all of us have had to be very brave over the last 6 months, and that's been challenging. And today and this morning, I am so honored by the conversation that we're going to have with our Brave Space conversation. Over the last 3 months, since June, the PFCC partners and the PFA network started the Diversity, Equity, and Inclusion Work Group, a critical work group led by people from the PFA network who represent the Black and African American communities. And together, they have bravely reached out to us, and together we've been able to create a trusted space for conversation. And they're bringing that conversation here today with all of us, to share their experiences with all of us. We are going to turn off video and ask that everybody stay muted through this session, but we will, I encourage you again to chat in your questions, chat in your reflections, chat in your support. However you can contribute to the creation of this community, it's critical. I invite you in, I implore you in. So with that, I'm going to turn the conversation over to Ayadola Anise, Director of Value and Culture for the National Academy of Medicine, to guide us through this really important conversation. Ayadola?
Thank you, Libby. First, I just want to say congratulations and happy 10th conference anniversary. We're just excited to be able to be here and to thank you for sharing this virtual stage with us. As you all have seen, the title of this session is A Brave Space Conversation, a partnership in the face of two pandemics. For all of us, we are aware that we are at a critical junction where we are facing two pandemics. One of them is COVID-19, which we started facing earlier this year, and the other is racism, which has been around for hundreds of years. And how we address both of these pandemics will really define who we are as a country, who we are in terms of the communities that we are in, as well as who we are as individuals. And the first step to addressing these pandemics is dialogue and discussion. And so that's what we are here to do today. We've also called this a brave space conversation, and we've chosen these words intentionally. We didn't want to call this a safe space conversation because oftentimes safe space refers to being free from discomfort or free from difficulty. And what we realize is that the conversations we're about to engage in today about structural racism, disparities, inequity, and equity, that requires us to lean into discomfort. It requires us to hear and learn from other people's perspectives and to be vulnerable in order to stay connected to our shared humanity. All of that requires bravery. And so we're asking the folks who are joining us on this session to be brave, and we're also asking you as audience members to be brave with us because we recognize that learning involves being uncomfortable. And it involves having a certain amount of unease in order to let go of a former condition in favor of a new way of seeing things. So thank you for being brave with us and for us. As Libby mentioned, we want to make sure that this is a conversation not just with those of us who are on this panel, but also with you all as the audience. And so we encourage you to stay engaged throughout this conversation. And make sure that you are part of the conversation. And so the chat feature is available to you to share your thoughts. And if you have any questions that you want to ask any of us, feel free to include those there. And then towards the end of the session, we will have some time to be able to take on and address some of the questions that you all have raised. So with that, I want to start with some introductions because I am sharing this space with some absolutely amazing people. And so I'm going to tell you one thing that I've learned about each of these people and then ask them to just share something that they feel that you as the audience should be aware of. So I'm going to start with Latasha Roos. Latasha has a passion for health equity that actually enters the room before she walks in. And you know that when you are in a meeting with her, she is going to really talk about solutions for addressing health disparities. And every time I'm in a room with her, I just want to snap my fingers whenever I hear her talk about health equity. Latasha, can you just share one thing about yourself that you want the audience to know?
I am a mother of a 10-year-old and a mother of triplets that were born at 26 weeks, and they are now 7 years old. And my experience in healthcare has been that it's what you've read about Black women delivering children. The stories that you've read resonate with me, have happened to me, and I share my experience because I don't want my children, my girls, my boys to have these stories to pass down in their families.
Thank you, Latasha, for that powerful reminder of why we're here today having this brave space conversation. Next, I want to introduce Patrick Gee. Patrick has the ability to see to the heart of things, and maybe that's because he's a pastor, but especially when we're talking about health and racial equity, he has this ability to unravel and deconstruct issues and then ravel them back up and construct them with hope so that we can all see more clearly. Patrick, can you just tell the audience one thing that you would like them to know about you?
First of all, yes, thank you. First of all, I want to say hello to everybody. I am a kidney transplant recipient in the 3rd year of my new kidney, as well as being a COVID-19 survivor. Probably the greatest thing to know about me is that my kidney disease launched my ministry. So because of everything that I went through and even stuff that's going on today, I have to remain hopeful and positive that, you know, a better day is coming.
Thank you, Patrick. I completely agree that a better day is coming. So thank you for that hope. The last person that I want to introduce is Deneen Green Rivers. Deneen is a beautiful storyteller and just has the ability and gift to transport you to a different place and moment and to translate lived experiences into shared humanity. Deneen, what's something that this group should know about you?
Greetings, all. I was raised primarily by both my parents, but I spent a lot of time with my grandmothers, and they were very strong pillars in our Black community. I noticed that they would empower everyone around us for voting rights and education, but when I would go with them to their doctor's appointments around 11 years old, they would shrink back. They would become so small in my eyes. And they wouldn't speak up about the ailments that they were being faced with every day at home and in the community. And so around 11 years old, I decided that that was a pivotal point that I needed to lend my purpose and my calling into sharing and including everyone in to finding their own voice and using it in healthcare.
Thank you, Deneen. I think that that is so important and really speaks to this person-centered health system that we're all trying to create to make sure that everybody's voice is heard. So now that we've had a chance to introduce all of you, I want us to transition a little bit to a story. As I mentioned, Deneen is just an amazing storyteller, and for the next several minutes, she's going to transport us through 400 years of history from the past to where we are right now. Deneen?
Thank you. I want you to get comfortable, pull up a chair, cross your feet, and close your eyes. I'm going to take you on a journey, sharing a vivid snapshot of events from the past that are crucially tied to the development of Black health inequities of today. Our story begins in the early 1600s, over 400 years ago in Africa. Imagine you are one of 15 million healthy African men and women, boys and girls, between the youthful age of 12 to 20, captured and forced to march miles until you reach the compounds on the coastline. There you would huddle in darkness, chained together, awaiting the vessel to transport you 400 miles away. Over 600 of you would be shackled by hand, feet, neck, with muzzles over your mouths, laying head to foot in the ship's belly without space to sit or move for nearly 3 months. 100 of you will die due to lack of clean air, little food or water, inhumane treatment, and life-threatening physical conditions. The hazards of your 90-day journey across the Atlantic are grueling, and the trauma and unsanitary conditions make mass suicide appealing. The day of your capture marks the beginning of generational physical, emotional, and psychological trauma. The moment you embark in America is the day of your first complete physical. You are examined naked from head to toe like chattel in front of hundreds seeking to purchase you for labor. Poked and prodded, turned and bent over, closely examined from your hair follicles down to the soles of your feet, all from the auction block that serves as the same chopping block for execution. Ironically, the place of your health and wellness check is the same place of your possible demise. Sold, off with the master who owns your body. This marks the beginning of racial health inequity in America. In 1830, Samuel George Morton wrote Crania Americana. He claimed that Black people had smaller skulls than whites, thus making them have smaller brains. Experts contend this marks the beginning of scientific racism. Surgeon James Marion Sims became known as the father of modern gynecology. He created his techniques by operating on enslaved Black women without using anesthesia. 1861 to 1865, during the Civil War, Black soldiers would die from wounds that white soldiers would recover from due to lack of supplies and treatment. 1913, sterilization laws were passed, and doctors began to sterilize African Americans 4 times more than whites. 1932, the U.S. Public Health Service started a 40-year syphilis experiment on 600 poor Blacks known as the Tuskegee experiment. Participants were told they were getting free medical care from the federal government, yet they were unaware of having syphilis and never received treatment. April 10, 1945, Ebb Cade, an African-American male, was the first test subject in the human radiation experiment called the Manhattan Project. He got in a car accident and fractured bones in his arms and legs. While waiting for treatment, he received injections of plutonium without his consent, and 15 of his teeth were extracted just to see the results of the radiation. October 4th, 1951, Henrietta Lacks, a 31-year-old African-American mother of 5 from Virginia, died of cervical cancer. Medical researchers used her cancer cells to study the effects of toxins, drugs, hormones, and viruses on the growth of cancer. The HeLa cells were used to develop the polio vaccine and in cancer and AIDS research. Do you know doctors never got Henrietta or her family's permission to culture her cells? 1960, the civil rights movement helped pioneer legislation such as hospital desegregation, but never full integration of equal access to care. The late 1980s into 1990s, African Americans are 10 times more likely than whites to die of AIDS. July 30th, 2008, the American Medical Association apologizes to the National Medical Association, which is a society of African American physicians. For more than a century, the AMA excluded Black doctors from its national society as well as state and local medical societies. April 4th, 2016. Half of 222 white medical students and residents surveyed at the University of Virginia believe Blacks and whites are biologically different, and Blacks felt less pain than whites. January 16th, 2020. The National Center for Health Statistics releases 2018 data on pregnancy-related deaths, showing Black women die 2.5 times more often than white women. 2020, May. COVID-19 complications disproportionately affect the Black community, but the alarming rate at which COVID-19 is killing Black Americans can be attributed to decades of segregation and poor race relations, inequitable access to healthcare, testing, and treatment. Ladies and gentlemen, Black people have been both negatively impacted, unwillingly experimented upon, and unknowingly used for research since the beginning of slavery. Dr. Maya Angelou said, "History, despite its wrenching pain, cannot be unlived, but if faced with courage, need not be lived again." You may open your eyes now.
Thank you, Deneen. You know, I've heard many of those points made, but to take us on a journey and to bring us up to where we are now in that really powerful way, I want to say thank you. And some of what that has helped me to understand is that we don't always hear this story. You know, we talk about disparities by race and ethnicity, but we don't really talk about the history that explains why. We talk about wanting a person-centered health system, you know, and now more than ever, there's really a need for us to center on equity. Since you quoted Maya Angelou, I want to also add another quote in there, and that is from Martin Luther King Jr. And he said, "We are not makers of history, we are made by history." And so we are where we are now because of the history that you've shared. And I'm wondering if we can hear from some of you all in the audience about what Deneen shared and how that has made you feel, or what you are thinking about it as it relates to this history and where we are now. I know that we're starting to see some comments with, you know, "I'm weeping with anger and renewed urgency to address racial inequities." You know, so important to understand histories. Thank you, Deneen. So thank you. Please keep on including your comments in the chat. We certainly want to hear your thoughts about this. And I'm going to also take a moment to transition here and, you know, start to bring us a little bit more into the reality of the present time that we are in. Deneen brought us up through COVID-19 and some of the disparities that we're seeing there. Patrick, I'm wondering if you can share with us a little bit about your personal story and about your experiences in terms of living at this present time through two pandemics.
Well, for me, the entrance of COVID-19 into the world brought about trepidations, anxieties, uncertainties, hurts, and pains that this world has tried to conceal for centuries. You know, just imagine for a second an invisible virus that has brought to light the things that were visibly dormant from the elite and the privileged. Before I got on this call, I had to look up the word privilege. And the definition of privilege is a special right advantage or immunity granted or available to a particular person or group. When you talk about healthcare equity, especially in COVID, I think about, as a person with a kidney transplant and I'm immunocompromised, it took me 4 attempts just to get tested after a person in my church had tested positive. They kept telling me I wasn't sick enough. And my thing is, I have no immune system. How sick do I need to be? Do I need to be like my community that has been impacted and is dying? Fortunately, I was able to get tested, and I tested positive. But then I was given a medication that took me from mild symptoms to more severe symptoms, even to the point of being hospitalized until I tested negative. But even from that, and listening to Denise's story, it just brings about the devalue in a person's life just because your pigmentation may be different. And one of the things, especially in ministry, is that even in the midst of all of this, we still have to cling to the healer in order for us to get through this particular time and day now. When you're living in a time where people want to politicize your illness, even the story that Denise shared is political because they don't believe that that's a part of American history, and they don't want that to be told. So we need to look within ourselves to find solutions on our biases and our own bigotry, not based on some social construct, but just based on your biology. We are all human beings, and we need to walk in that love. So thank you.
Thank you, Patrick. You know, I cannot echo enough what you've said, just, you know, in terms of seeing how things have played out with COVID-19. And it's almost as if we are rewriting history or repeating history. And that there's really such a need, as you said, for us to take a look at ourselves as, you know, who we are as people, our own biases, our own privilege, and understand where we can use that to really help drive health equity forward. Latasha, I want to turn to you. You know, given that our present is so tied to our past, and Patrick has talked about the disparities due to COVID-19 and his own personal experience, can you tell us a little bit about the impact of disparities and racial inequity within the context of maternal and child health?
Absolutely. So as Denise stated, the statistics show that Black women are 3 to 4 times more likely to die in childbirth compared to white women. And Black infants are also 2 to 3 times as likely to die in their first year of life compared to white infants. And then you also tie that to looking at maternal mortality, and after reviewing those cases, they find that 2 out of 3 of those cases were preventable. Women went in and asked for help and were turned away and said that it was normal. They weren't listened to. And so that to me is striking, but also I lived it. After having my triplets, they were born early, they were in the NICU, and I had a hemorrhage 20 days after they were born. And I was at home in the middle of the night, and I woke up because I felt something wet, and I couldn't figure out what it could be. I'm in the bed. So I lift my hands and I hit the bed, and it splattered. So I got up and I started to walk to the bathroom. I turned my bathroom light on and I looked back and I saw all the blood. It looked like a murder scene. So I called 911 for them to come and get me. My mother was there. My son was there. He was 3 years old. My husband was out of town. And I called 911 and told them what was happening. They were coming to get me. So I'm just waiting. I had a bath towel between my legs to contain the blood. That's how much blood it was. And I stayed there because the more you move, the more you bleed. So I stayed there and I waited to hear the ambulance come to get me. I heard them come up. I go out into the living room and I'm thinking they're going to take me off. Like they're going to take me out. I'm not going to have any time. And once they get there, they start to ask me questions. They wanted to know, what did I take? They wanted to know, what had I been doing? And during that whole time, no one ever went to go and see how much blood I lost. But they wanted to know what I took, because I was almost out of it. My head was doing this. And it was just kind of, I was trying to hold it together so that they would take me. And I couldn't be mad, because the last thing I needed was for them to call in help. So asking for that and having them come in and not see me as a priority and then take me into the ambulance to talk about going to Starbucks on one of the worst days of my life, I understand how the stories happen. I understand how women die when they're not listened to, when they're not made a priority, when in that instance, a person sees a stereotype and not the person in front of them, that they are there to help. And I know that when those people went home that night, they have no idea what experience I had. They went home, surely that they had done their job, they got me to the hospital. But unless I tell them, they don't know that what they actually did was, there were some steps in there where they made me feel as though there was something I had done or could have done to cause it, and they believed that to be true, and it wasn't.
Natasha, I thank you for sharing your story. I can only imagine what it was like to go through that experience. But I'm glad that you are here today in order to fight for mothers and women of color, because your voice is desperately needed in this fight. And as many of you, I'm sure, are aware, that these statistics, that Latasha mentioned for maternal and child health, you can cut across to any other condition, asthma, hypertension, diabetes, and you're going to see the same numbers. And you're going to hear some of the same stories behind it. It's that we have stereotyping, we have unconscious bias, it's that we have structural racism that's supporting all of these things. And, I'm just mindful that as we start to have this conversation and as we talk about racism and disparities and lack of inclusion, that we also have to make sure that we have a shared definition of what racial equity looks like. We've talked about, racism and disparities, but what does equity actually mean? I think racial equity is where the color of your skin does not result in being valued or devalued from a cultural perspective, from a structural or organizational perspective, or from an individual perspective. And I want to be clear that equity is different than equality. Right? Equality is everyone gets the same thing. But what we've heard from the story that Deneen shared, and as I'm seeing in the chat that many of you are aware of, right? But when you hear it in that chronological order, what you come to understand is that it is not about us getting the same thing. It is about all of us getting what we need in order to actually have a chance at being successful. So I want to, with that, switch gears now that, hopefully there's this understanding, not just of what we mean by racism and disparities, but also in terms of equity. And I want to turn to Deneen. Deneen, with storytelling being so valuable and a tool that you have used, and, also with us hearing the personal stories of Patrick and Latasha, can you tell us a little bit about your own experiences with patient and community partnerships and how they may or may not have really incorporated, racial equity at the center of them?
Certainly. Well, first of all, let me say storytelling is like the Black American library. It's a place where when they're shared from generation to generation, you take it to heart and you use it to decide the do's and the don'ts in life. And so what we've been hearing, or what I've been hearing in my community, are a lot of negative stories regarding healthcare and access to healthcare. So if you start out in life hearing only bad things about your medical visits or experiences in the ER, or if you get sick, don't go to the hospital or don't say anything, don't speak up. And this is what you continually share generation to generation, then there's a divide, a huge gap. And so when you have the medical community to say we'd like to partner and collaborate with the Black community, there's already a huge disconnect or distrust due to mistreatment that has followed us through the timeline and is still here. So I may not have lived 400 years ago, but those stories are embedded in my life today. So what I'm seeing now in 2020, the Black community is saying it cannot be business as usual. How we have partnered with medical establishments and research companies in the past, maybe one person was at the table, but that was a person they chose to represent many voices. And so now we're saying no more. And no more do we come to your table, you have to come to ours. And there has to be a level of respect earned and a value component. And in order to value the person, you really have to get to know them. You got to dig into the trenches. You've got to come from the CEOs down to the people who are the ancillary staff and get involved in collaborations on a ground level. And we haven't seen that in the past. So I'm hoping moving forward, since we're having all of these discussions now, that we'll truly take stakeholders that look like you and I and bring them to the table with leaders in large healthcare systems and bodies, and then ask them, what do you need us to do to help ensure access, and not just access, but exemplary care for people in the Black community? That's what I want, because you can have access and it still be poor service. And I think we're tired of poor service. So the standard should be exemplary healthcare for all, not just for one group or one body of people. So that's what I'm seeing right now when it comes to working on partnerships and developing relationships in the Black community in our healthcare setting.
Thank you, Deneen. I'm grateful that we're starting to see some shifts, and there are a couple of things that you've said that just have really resonated with me, and in that it's really important to make sure that we have stakeholders that look like you or I at the table, and that what it takes for that to happen means going outside of comfort zones. It means doing whatever is necessary to make sure that the people who typically don't arrive at the table can have a place for themselves there. And as you said, it's really about going to their table and trying to find ways to make sure that happens. I see the chat box, and people are continuing to write in your comments. I just want to encourage you to continue to do so, or to start to do so. And that if you have any questions for this panel, please enter them into the chat feature. We will have some time towards the end for you all to be able to ask your questions of them. So I want us to continue with this forward momentum. We've talked about the history. We've talked about where we are presently as it relates to COVID-19, as it relates to disparities in healthcare, and in particular maternal and child health. And we've talked about partnerships and the need for making sure that we have inclusion within the partnerships. I want us to transition to talk now about where we can go, what our future can look like. In a conversation that Deneen, Latasha, and Patrick and I had, we were talking about COVID-19 and how many of us have had to put on masks in order to protect ourselves from the virus. But as people of color, in this time with George Floyd and all of the people who have experienced police brutality before him, and all of the people who have come after him, we've been talking about how we've been wearing masks for such a long time. We wear masks when we go to work. We wear masks when we go to the doctor's office, when we're interacting with our kids, teachers at schools. We wear masks in a lot of different places. And that's what we've had to do in order to survive. We've had to be uncomfortable in most settings in order to fit in. And the irony of the mask debate, particularly during COVID-19, is that for a lot of us, as people of color, because we have to wear physical masks, that it's shedding some light in terms of where we are as a country. And many of us are starting to take off our emotional, psychological masks and finding ways to make sure that we can show up as our authentic and unique selves. And that is, I think, one of the blessings of being able to be a part of PFCC Partners with Libby, is that she's given us that freedom. And so I want us to switch gears and talk a little bit about the future and what it looks like when we are able to freely and uniquely be our authentic and unique selves, when we are able to take off our masks. And so I want to start with you, Deneen. As someone who is a storyteller, who advocates for change, what would it look like for us to be able to take off our masks, and in particular in this journey with patient and community partnerships?
Well, let me add this. Even with a mask, the mask that we wear now, figuratively and literally, your voice is muffled. It doesn't come out quite the same. Sometimes when you're speaking and you want to tell your truths and you want to talk about your grievances, somehow the mask that Black people wear every day in healthcare, even those that are being seen and those that are providing the service, their voices are muffled or watered down. They're quieted. It's almost mouse-like. And they don't have enough people around them to amplify their voice or to help them feel comfortable in amplifying their voices. So I think the first thing we've got to do is make sure from top down, from leadership down, not from down up, we have to create safe spaces and places in those work environments with providers. And when we do that and we decide that we want to be a part, we want to hear what you have to say, and that we're comfortable with hearing not just the good things, but any grievances that you might have too. The conversation has to start on that level. We have to readily acknowledge racism. We have to. It exists on so many different levels, and in the past, it's been skirted under. And no more of that. We can't do that, and it cannot be tolerated from a leadership level. Secondly, I think we have to look at all of the different types of health disparities and how it relates to the mask wearing for patients and families. You can't tackle helping someone with their health or chronic healthcare needs without discussing all of the healthcare disparities. So those conversations about food deserts, employment, transportation, policy, lack of income, poor childcare, education, all of those things are under a unique umbrella if we want to move people forward to have adequate and sufficient health care. Then every one of these things has to be addressed. And I don't know that we simultaneously do that. We pick and choose which category we're going to work with somebody. So for instance, if it's diabetes, well, let's just tackle the food issue with diabetes, and we don't look at the other environmental factors. So I think that's important. Additionally, we've got to start looking at policy. Policy is huge. And I don't know that we talk about policy enough, or that we invite people of color to the table to discuss policy. Policy shapes how much funding comes into your healthcare environment and into the community. And so educating people on policy and being able to share their voice in the policy-making process is equally as important.
Thank you, Deneen. There's this, statistic that a person's healthcare only makes up about 15 to 20% of a person's well-being. Right? The rest of it is the social and structural determinants of health. And if we only try to focus on that sliver that's healthcare, we're missing out on so many of the other things. And you know, structural racism is embedded in those other things as well. And so I think your point about policy and needing to shape policy and change policy is really critical. Latasha, I want to turn to you, and it's really a very similar question. What does taking off the mask look like for you when we talk about health equity, and in particular maternal and child health? What do you see as needed for the future?
We definitely have to have, you know, people of color at the spaces where the people make decisions. And it can't be one, it can't be sometimes, it can't be the chosen one, it has to be everybody. And there needs to be an avenue created for people to participate. There has to be a welcoming of it, and not have it be the exception. You know, and when we get there, we got to say it. We got to tell them all of it, because if we don't say it, they won't know.
Thank you. And Patrick, same for you. You know, what would need to happen for us to take off the mask, literally and figuratively, as it relates to us, you know, being in two pandemics with COVID-19 and with structural racism?
Well, just like it's been said already, you need to look at the multi-layers that people of African descent have had to wear before COVID-19. You know, people of African descent living in the United States have lost their identity, and their identity have been given by white folks. We were first slaves, then we was the N-word, then we went to colored, then Negro, then Afro-American, African-American, and now multiracial. So we need to find our own identity. We also need to incorporate better mental health treatment. People fail to realize that intergenerational traumatic disorder is real. Everything that people of African descent have had to endure all the way from their ancestry till today is making an impact. You know, people are making life decisions whether to go out the house with a mask in fear of just going to the grocery store to buy groceries, wondering if they're going to be stopped by the police, if they're going to be cursed out, if their life is going to be in danger when they're confronted with somebody that's feel offended for wearing a mask. Like with myself, with a compromised immune system, also being at risk with COVID, with diabetes, kidney disease, and hypertension. If I took off my literal mask, would you respect me? But yet and still, if I don't look sick, if I don't talk like I'm sick, if I don't think like I'm sick, but yet and still, I carry the weight of my family every time I step out the door, praying that I can come home and live another day. So until we can get respect for everybody, until we can all go in the woods, cut down a tree, build a table together, build the seats, and sit down where nobody has ownership of the table, and we can have dialogue of how broken this health system is, and how all we want is just equal treatment, care, and solutions. That's my thought for today, and that's my prayer going forward.
Thank you, Patrick. You know, I definitely agree with what you're saying, and you know, I love this notion of, you know, the table doesn't belong to anyone. In fact, why don't we just get rid of the table? Do we even need a table? Right? So I know that folks have been continuing to include some comments in the chat. We've received a couple of questions, and if you have more questions, please keep them coming in the chat. I want to take a couple of moments to ask you all some of the questions that we have received. One question that we've received is, how do we make sure that the partnerships are authentic when people of color get to the table?
For me, I would say, let's have a dialogue. Let's talk about what it is that you don't understand. And then let's talk about the collaboration of how we can broker a partnership. All of this is just through basic engagement, having an understanding of who we're dealing with so we can come together.
I think you also need to know what's important to that person. You know, what did they come here to help with, and make sure it happens. Don't have them come and sit at that table and tell you of something that happened in your hospital and you not address it.
I believe that we need to be careful to make sure certain people don't have agendas. Like, what are your agenda for being at the table? Because you still have to develop a relationship, a committed relationship, a partnership that's not one way and one time. And what we've seen in the past is, if there's a particular chronic illness we're working on, we'll bring a good old token person to the table and we'll work out these wonderful agreements and policies, and then they die. Nothing happens, nobody comes back, and it's not truly solution driven or solution focused. So I'd like to say to everybody who wants to be change agents, just honestly, if you're coming from a good place, everybody around the table will see it. They'll hear it, they'll feel it. It's not hard. It will be so easy. Just so often, we just don't see the other person who doesn't look like us as being like us. And I think that maybe we need to personalize it a bit.
Yes, personalize it, and essentially for everybody to realize that the history that you share isn't just, you know, my history, your history, Latasha's history, or Patrick's history. It's all of our histories. It affects all of us, and that we can't actually make progress until, you know, we are in this fight together. In the interest of time, you know, we won't be able to address all of the other questions, but, you know, keep the questions going. From what I understand, Libby is going to be curating all of the comments and the questions from the chat. And so we certainly want to continue to capture this information and continue this dialogue and conversation, because this isn't really about us having one conversation and then that's it. This is really the start of a more public conversation and dialogue. You know, one of the things that I've come to understand is that this journey towards racial equity is not a sprint. It's a relay marathon where we're running for a long-term goal. You know, it's not, you know, a short sprint. It's something that we have to, you know, really think about for how we want to move forward in the future. But it's also a relay, because we need each other in order to make it to the finish line. And so we need movement, we need progress, we need action, we need change, but we need to remember that we are in this together. In terms of closing out this session, I'm wondering if we can hear from you all about one thing that you think that the audience can do, or start to do, or think about doing to help transform the spaces that they're in to ones that really are centering racial equity and where racial equity is at the forefront. I'm going to start with Patrick.
Thank you. In the Bible, in the book of Luke, the 10th chapter and the 27th verse, Jesus said, "Love the Lord your God with all your heart, with all your soul, with all your strength, and with all your mind, and your neighbor as yourself." Your neighbor, not just people that you hang out with, not just people that's in your culture set. We are all neighbors. Even though I can't see you, I love you. So if you love your neighbor, then there won't be a need for a mask. There won't be a need for any inequality, because all we want is peace.
Thank you, Patrick. Latasha?
I will say this. I can't speak how Patrick speaks, but I will say this. As a patient and family advisor, when you're in spaces and you know that there is no diversity in that space, ask about it. Bring your friends that you know that are of color. Introduce them, connect people, and don't just take that space as your own. No one owns the table.
Yes, Latasha. Deneen?
I just want to say this is the start. I think it's so beautiful for the amount of people who have decided to register for this conference. And you already knew what was going to be at the starting gate of the conference, and that was to discuss racism overall in healthcare for the Black community. You could have decided not to do it or log on late. So I'm asking you to take what you learned today and take it back into your own spaces, your own healthcare four walls, and don't keep it to yourself, share. And anytime there is a position where you can learn, where you can gather and grow, if there are conferences that are available or platforms where you can attend and begin to garner new relationships and partnerships with people who look like me, do it. Go for it. There are so many opportunities, and a lot of times we wait on them. Don't wait on it. Step out, go out and meet some people and have some authentic relationships. It truly starts there. Thank you.
Thank you all. I love those pieces of advice. Before we close out, I would like to leave this audience with one final thought, and that is, we started out by talking about our history. We don't have to be limited by our history. In many ways, our history is like our DNA, and it represents the things that are passed down from generation to generation. And in the case of the United States, there is a racist infrastructure, systems, cultures, behaviors, and beliefs that are centered in structural racism, and that has been passed on. But we are more than what is passed down to us. Our environment also has the ability to shape our genetic makeup and our DNA. It won't be easy, but when we start by examining our own personal journey and experiences with racial equity, we start to take the mask off of our eyes. When we start to engage in dialogue with diverse people, and we start to seek to understand, not to be understood, then we continue to change our genetic makeup. And when we intentionally give up power, when we act with justice and racial equity in mind, that changes our genetic makeup even more. And then that's what is passed down to future generations. And I would encourage all of us to really start to center or continue to center equity in such a way that we are remembered as the ancestors who created a change for this country, that we are remembered by the future generations as the one who led us into a brave, different world. So I want to honor and thank Denise, Latasha, and Patrick for their bravery in this conversation. I want to honor and thank you all as the audience for participating and listening and making comments and asking questions in the chat. I encourage you to continue to do so and to continue to share how you all have thought about ways to center equity so that we can continue in this conversation. With that, I want to hand it over to Libby and just thank you for your fight and for allowing us to center equity in this conversation.
Wow. Thank you so much, Idola, Latasha, Deneen, Patrick. You have opened so many minds and thoughts, and I would invite all of the participants, every single one of you whose name's on here, what insights did you just gain over the last hour? What ideas does it spark? What fears does it spark? What reflections do you have? I would really love for you to share that with this community so that we can move forward together. As you do that, I'll just make mention that this very much is the beginning of a conversation. This isn't over by any means, and it's going to require, I can tell you, humility and a willingness to step into the uncomfortable, right? There's when I reached out to our Black community within the PFA network, I fumbled. I probably didn't use the right words. I probably offended some that maybe didn't know me as well or didn't know where my heart was. So I guess, maybe this is too mushy or cushy, but just go in, have a conversation, start a conversation, admit to your discomfort, own it, and share it. And so just really would love to see everybody walk away from this session in action on raising equity in your health systems. Every single one of us on this call, no matter where we are in our lives or where we are in our professions, we have an opportunity, a unique opportunity to each of us. Each of us has to contribute to this conversation. So I invite you in from the bottom of my heart. I cannot thank this panel enough. Ayadola, the way that you orchestrated and brought this team together is nothing short of phenomenal. I just am so incredibly grateful for you. Deneen, you and I are just getting to know each other recently, but your fire and ability to tell story and connect people to it is unrivaled. Latasha, your passion, I love that. Patrick's dubbed you good trouble, and you're absolutely right. Your passion is going to make great change in this world, and I just so appreciate you sharing some time with us today. And my friend, Dr. Gee, man, you just inspire all of us to keep going and believe that we can. We have to believe, and you always supply that belief. So to each of you, thank you for sharing your wisdom. Thank you for sharing your experience. Thank you for sharing your humanity with this group. I know we're a couple of minutes over, but this was just too important to cut short. So again, this is the level set by which I want you to attend every other presentation and think of, through the lens of equity, how can we continue and expand the extraordinary programs you're going to hear about over the next 2 days. And with that, I believe we have the next sessions at, we have a little bit of a break, which is great. I would encourage you to sit alone for a few minutes, take a deep breath or two, absorb what you've listened to, and maybe make a few comments to yourself. And then at 10:15, we'll continue with the next sessions. I invite you, there's Laura, way to go. She's got the links for you right there in the chat box if you don't have them. Otherwise, thank you for coming this morning. Thank you for attending this conference, and I look forward to talking with you more.